So Rucaparib is a PARP inhibitor that's licensed for maintenance therapy in patients with high-grade ovarian cancer that's responded to platinum-based chemotherapy, and is used quite widely both through Europe and North America. The trial was first presented at ESMO in 2017, and here we have presented an updated analysis looking at patients who entered a partial or complete response after the chemotherapy phase before they entered the maintenance phase with Rucaparib or placebo. Because many patients with recurrent ovarian cancer who undergo chemotherapy respond but don't have a complete response and are left with residual tumor by the time they start a PARP inhibitor. And what we showed in this supplementary analysis was the effect of Rucaparib was similar in patients who had a complete response or a partial response. So both groups of patients benefited to a similar degree. In absolute terms, the progression-free survival was greater in those who had a complete response before Rucaparib, but the magnitude of the response in terms of the hazard ratios was similar across both groups. The other point that came out of this analysis was that a proportion of patients who entered the trial of Rucaparib or placebo had measurable disease at the end of chemotherapy. And what we could see was that in patients on Rucaparib, there was a response in many of these patients, a further response, if you like, to the PARP inhibitor while they were on the maintenance, which I think underscores the importance of maintenance therapy, not only to maintain the response, but also to deepen the response. And in fact, in the BRCA population, there was a 37% response rate just on the maintenance olaparib phase of the trial.